I'm Dr. Sam Hughes, and here at Statesville Primary Care we offer fitness testing. Specifically, we do VO2 max testing. We're able to do that here with a treadmill or a bike. What that does is measure your fitness capacity. There is a strong correlation between your fitness capacity and your longevity. So this is not only for athletes, but also for people that are wanting to improve their overall longevity. It is also good to recheck every now and then as you continue to improve your health through diet and exercise to see the improvements that you make and to see the progress we get on the lab testing here in our office. RMR is resting metabolic rate testing. This is good for pretty much everyone to know. It tells you how many calories you burn at rest. That way you know how to change your nutrition strategy towards your goals. So whether that be maintaining your weight, gaining weight and muscle mass, or losing weight. We can use those numbers to help guide you and to determine a nutrition plan for you to help meet your goals, whatever they may be. So for VO2 max testing, you probably have seen athletes run with the big mask over their face and lots of wires hanging off of them to see how well they're going to be able to perform. This is a test we do here, but you don't have to be an athlete to be able to do that, nor do we have the wires. It simply is a mask that you wear while you exercise. And the reason why this is good, not only for athletes, but also for the general patient, is to determine where you're at in regards to your fitness. That can always be improved. It doesn't have to be towards a certain athletic goal, but by improving your VO2 max, you can improve your longevity, which is something that everybody should be working towards. Using the VO2 max, we not only know what your fitness level is, we also get heart rate data, and this can help further develop your fitness plans. And it is also good not only to know where your baseline stands before training, but get an idea where it is afterwards to see the progression that you're making. Whole idea is to improve that VO2 max over time and continue to steadily improve your fitness over time. With primary care, what we do here is a little bit of everything. We tackle not only acute issues, but also try to prevent issues before they come up. One of the biggest goals we have with our health is preventing problems from coming up and making sure that we're staying alive as long as we can and as healthy as long as we can. Knowing this data about VO2 max, because there's such a strong correlation with it and longevity, is good for all of our primary care patients to know so that we can try to help guide them towards that longevity goal. Resting metabolic rate testing is very easy. All that involves is sitting in a chair for 10 minutes in a relaxed position. You wear a mask over your face and you breathe in and out just like you would regularly. Our nursing staff sets it all up for you. You sit in a comfortable room. After 10 minutes, we take off that mask. We get the data together for you. We go over that data, which gives us what your calorie burn rate is over the course of 24 hours. And it's as simple as that. VO2 max testing is a little bit more involved than resting metabolic rate testing, but similar. You'll wear a mask over your face and you exercise at your maximal capacity. So that will be running on a treadmill or cycling on one of our bikes here until you feel like you're no longer to go anymore. That gets us data at not only your heart rate zones, but also your VO2 max. After you're done with the test, we remove the mask, we get your data printed out for you and go over it before you leave. Using the data we get from the resting metabolic rate testing, patients can guide their calorie intake throughout the day. Knowing exactly how many calories you burn can help with determining how much you eat that day. If your goal is to lose weight, then they would eat less calories than what we find is a resting metabolic rate. If their goal is to gain weight, they would want to eat more. So using the data we get from the resting metabolic rate testing can guide their calories either up and down depending on what their goals are. One of the biggest mistakes we see is not knowing your numbers. If you know your heart rate zones and you know your resting metabolic rate, we can use that to accurately guide your fitness plan and also your nutrition plan. You might know that your smartwatch can calculate your VO2 max, but it does that only based on your heart rate. It uses some algorithms and fancy math to come up with the estimate of your VO2 max. May not actually truly represent your VO2 max. What we do here is actually measure the maximum amount of oxygen you're absorbing with exercise, and that gives you a much more accurate result. And in addition, we're tracking your heart rate during that time to calculate heart rate zones based on your oxygen intake. I think fitness and longevity should be a goal for everybody. Here at Statesville Primary Care, we not only offer primary care services, but have the ability to track VO2 max, resting metabolic rate testing, and doing so help guide you towards those goals.